Good evening, Israel, and good afternoon, New York. So, it's interesting. I was talking to a friend of mine, and we both agreed that we don't like it, or we don't appreciate it, when people do what's called pulling rank. What do I mean by pulling rank? You're arguing with somebody about whatever topic, and they want to show you that they're right and you're wrong, that they know what they're talking about, and you have no idea what you're talking about. So what do? Sorry, I just ate something with the wrong pipe. So what do? They pull rank. They say, I have years of experience in this particular field, and therefore I know what I'm talking about, and therefore you by default don't know what you're talking about, and it doesn't really matter how much research you've done independently. There's no possible way you could have come to an educated, opinion and conclusion on this particular topic, because I worked in this field, and it stands to reason that I know more than you. So, my friends, at the risk of doing what I really don't like, that other people do, I'm going to, I guess you can call it pull rank, but it's not really pull rank. The difference is people who pull rank, they give you their credentials, and then they just proceed to insult you and then run away. They don't actually give you any sort of information or any sort of argument that is counter to what you've put forth, that what you brought to the table. I'm just going to let you guys know that I spent the better part of the last 20 years in and around the markets, the stock market, the American stock market. We're talking the end of 2002, September 2002, until today. From 2002 until 2010, I was very, very active in the markets. I was what they call a scalper, a day trader. From 2010 until 2014, I was more of a fundamentals investor and trader. And since then, I dabble here and there. And I will just tell you guys, I've seen press release after press release after press release after press release over and over and over again from pharmaceutical companies, big and small. Some of the smallest pharmaceutical companies, some companies that are listed on what's called the OTC exchange, not even on NASDAQ, what's called the pink sheets, companies that don't fulfill, listing requirements, but, companies that claim to be developing this particular product or this drug or whatever it is, right? And I've seen thousands of press releases. Some of them are what's called phase 1, some of them are phase 2, some of them are phase 3, and some of them were press releases that spoke about products that received, approval from government bodies, to be sold on the open market. And the thing is, obviously some of these press releases are what's called actionable press releases to where you can actually, take a trade. You can actually make money. You can say this is a significant thing, and you could actually take a trade on this information. And some of them were not. I will just tell you guys that usually, more often than not, it takes the FDA. I'm just going to use the example of the FDA because that's the most common one. It's in America, right? It usually takes the FDA anywhere between 3 to 5 years to fully approve a drug. For example, my father, he used to have hepatitis C. So he was part of, voluntarily, he put himself into two different studies, 2 different trials, experimental use. One was a drug called interferon. I forget the name of the company that produced it. This was like 20 years ago, and it was a very, very heavy experimental thing. It had an effect on him more so, less physiologically and more so psychologically, I would say. And then later on, he was part of a study that was conducted by Gilead Sciences for another drug, I forgot what it's called, also for hepatitis C, which ended up curing his hepatitis C, but also gave him a bevy of other issues unrelated to his liver, because hepatitis C is a liver issue, right? So we understand that any drug that's being tested, whether it's phase 1, phase 2, even phase 3, like if you're participating in an experimental study, by definition, any person who's in this field will tell you, or any person such as myself who was an investor in these stocks or looked at these stocks or wanted to take a trade, whether if it's 2 hours or 2 days or 2 weeks, understands that these things have side effects. It's just, it goes without saying. You don't even have to say it, right? It's just understood. It's not even a question. It's not even a discussion. Okay? My friends, what I'm trying to say is that at the moment, I'm going to preface before I say anything. I'm just going to say, I believe that these things that were released into, as so to speak, a treatment for the ailment that we have across the world, these things, I believe that they work. I believe they're effective to some extent, right? Whether it's against the main thing, they're 90-something% effective. Whether it's against the new thing, which is, depending on who you ask, 60%, 70%, 88%, who knows? We don't know. Point is, by and large, they're effective. But, my friends, if the body that is set to approve such medicines is telling you, first of all, if we understand that it takes them anywhere between 3 to 5 years to approve such things, and the medicine that we have now supposedly was what's called put on a fast track, or what they call Operation, I'm not going to say the name, WS, right? That's already what's called very fast. So at best, according to Wall Street and according to regulatory bodies, we're in a phase 2 trial. We're in the largest, probably I would say the largest phase 2 trial in the history of mankind. So my friends, with that said, as I mentioned before, just 2 minutes ago, we understand every person on Wall Street, every person in the industry understands that when you're in an experimental trial, understands 2 things. First of all, that probably some of the people participating in the trial are receiving, by the way, a placebo. So in this particular case, it seems to me that it's a double-blind study without people actually knowing that it's a double-blind study, really. So some people may have gotten the placebo, a good amount of people. Let's just say safely, for argument's sake, 50%. On top of that, by default, my friends, there will be side effects. The side effects are not known. They will not be known for a while. Some of them may be known immediately. There is a website where people go and report these side effects. The website is very cumbersome in this particular case. I happen to think it's cumbersome by design. Anybody who talks about side effects is obviously, right now I'm talking about them. I'm putting myself at risk of being, censored, ostracized, censored, what have you. My friends, this is basic stuff. I'm not saying anything that's like out of bounds here. Nothing new. It's not a hiddush, right? It's not like anything crazy. But for some reason, my friends, people, I don't know why. I don't know if it's like they want to make themselves feel better about their decision. Never happened before. Just one sec, guys. Let me switch over to Wi-Fi. Okay. Whatever the reason is, people have got it into their heads that everything is hunky-dory. They don't want to be told that, hey, listen, you voluntarily chose to be part of a phase 2. Now we're entering phase 3 because now we're going to have the follow-up, boosters, as we call them. Now we're entering phase 3. And they say, by maybe January, let's say, these governmental bodies might approve this, officially. Even so, my friends, it's very, very fast. These governmental bodies are what we call much more machmir than they are right now. So let's say, even if that's the case, my friends, whenever one of these bodies, or whenever this body approves any drug, they must, by law, list all of the side effects, not only of the side effects that they think, that are potential, all the side effects that actually happened, that actually went down in the study that they conducted, which is actually now. On top of that, they have to inform anybody who participated in the study of, or they have to inform people what the side effects were of the people that participated in the study. They have to ask people if they want to participate in the study. They cannot coerce them into participating in the study. It's something called, informed consent. My friends, there's all kinds of laws that goes into these things. Things that are not approved by these bodies, there's all kinds of processes. There's all kinds of laws. For some reason, I know the reason, because people have been whipped up into a frenzy, into fear. We've bypassed these processes. Not only we bypass these processes, people seem to think that everything is on the up and up. And I'm here to tell you that it's not. Again, this thing works. It does work. The question is, you have to know what you're getting yourself into, my friends. You have to know. And if you don't know, and if the people that are trying to tell you what it is, or maybe what it is, are being censored, or you're calling people that are spreading what's called misinformation, this is a big, big, big problem, my friends. This is a very, very big problem. And the same people are telling you, well, in case anything goes wrong, there's no one to sue until at least the year, 2024 or something like that. And even then, good luck getting a good lawyer or whatever it is. I just don't know what we're doing here, my friends. I really just don't know what we're doing here. So those of you guys might be asking, Tzvi, this is a platform, you talk about Israel and the Middle East, why are you talking about this topic? I'll tell you guys something. I had friends message me in private and they said, Tzvi, listen, you have a big platform, why don't you talk about this issue? And I said, listen, I don't want to get canceled. I don't want to get canceled. I don't want to be deplatformed, whatever it is. But at this point, I said to myself, I got to do what I got to do. And frankly, if it's Hashem's will that I get deplatformed or temporarily, put in timeout, whatever it is, at this point, it really doesn't matter. The message has to get out there. It's got to get out there. There's one other thing I wanted to tell you guys, but it escapes me at the moment. It's interesting. Last year I was telling some friends that, and I was watching what was going on in Israel, and I was trying to tell people, people are not being forced to take anything here, but they are being coerced. And I remember when they started doing this whole Green Pass stuff here in Israel, and I said to a lot of my friends, I said, if they try this shtick, if they try to pull this shtick in America, it's not going to matter, people from the left wing, people from the right wing, it's not going to matter. People, New York Times just came out with an article today basically saying that it doesn't really matter. People from all across the political spectrum are expressing their reservations with this thing and their hesitation or whatever it is, and they also are expressing their disdain with what's called the vaccine passport. And I said, this kind of stuff is not going to fly. Maybe in Israel, and I don't mean to insult anybody, but maybe in Israel people don't really have a concept of, personal autonomy, personal freedom. Most people, not all people. But in the United States of America, oh baby. I'll tell you guys something. This kind of stuff is not going to fly. Okay? People will not stand for this. I'm already seeing it on Twitter. I'm seeing it all over the place. People are not going to stand for this stuff. It doesn't matter where you go. It doesn't matter what political party. They're not going to stand for it. It's gonna be a problem. It's not gonna end well. Here in Israel, people are, everybody. What is it? I remember Naftali Bennett recently came out. I respect your opinions, but the time for debate is over. Everybody has to do their civic duty. My friends, the founders of the state of Israel, these people came from the former Soviet Union. It's a very collectivist mentality. Yeah, see, skeptical about without total side effects. Listen, that's my issue. That's my issue here. But yeah, guys, this stuff is not going to fly. This stuff is not going to fly, And again, I hate to tell you guys, for those of you guys who have taken this thing, I hate to tell you, but you voluntarily volunteered yourself to be part of a phase 2 trial. This is the reality. At best, it's a phase 3. Probably phase 2. Right now, we're entering phase 3. Right now, we're entering phase 3. We're entering phase 3 because now we want to see, now we have variants and we want to see how these things work against variants. That's usually how these things work, right? Guys, again, I'm speaking just as a person who spent 20 years on, in and around trading and investing and just reading press release after press release after press release and realizing what's significant and what's not significant. And taking action accordingly. Yeah, my friends are writing humanity after the flood and the Tower of Babel is in phase 3. Yeah, listen, that's a different story. I mentioned that to one of my relatives, Erev Shabbos. I said, listen, we're as my Rav says, Rav Dror, creation is broken. We broke it. And, just like with Nimrod and the Tower of Babel, one person had to go against the entirety of humanity. And I said, if you want to see the concept that you learn in school, what is popular is not always right and what is right is not always popular, come here to Israel. We're on the forefront of that. We are basically the benchmark of the world, and you will see what it means, the concept. What is popular is not always right. What is right is not always popular. We have so much social pressure here. Come on. All the normal people are doing it. Come on. We want to open this. We want to open that. Come on. Back to normal. Back to this. The time for debate is over. Do your civic duty, my friends. All you need to do is open a Tanakh. My friend who's writing here, he understands what I'm saying. I can't quote you verse line, and page. But he can, and he can attest to what I'm about to say. There have been so many great kings in our history, in the history of this nation, where they were, amazing kings and amazing leaders for the first, let's say, 19 years. And in the 20th year, they set up Avodah Zarah, and we know how the rest of the story goes. And then the leader after them took the Avodah Zarah, the idol worship, to the next level, and calamity. My friends, there were universes that failed. We're the one that works. Just imagine. Yeah, listen, that's already a Kabbalistic discussion, but phase this, phase that. Yeah, sure. But, you don't, the story of Adam and Chava, everything was premature. You prematurely took the drug before approval, and you got a side effect. You got side effects. And we see that history is replete with these things, where we basically, we venture off into realms we're not supposed to venture off, whether it's Sodom and Amorah, whether it's this, whether it's that, the plague, and Hashem has to, just say, listen, these people are beyond reprieve, and I have to just wipe the slate clean and start all over again. That's a different discussion, but why would states like Israel purposely put the future and health of people in jeopardy? Listen, and to give you a short answer, that we had a leader who wanted to be the hero. It was election time. He was seeing that he wasn't getting, he wasn't able to form a coalition. I don't know what, 2 times, 3 times, 4 times the charm, and he just kept going and going and going. People begin to be blinded by their own, it's like hubris and power and just. That's it. They want to be the hero. And they make deals, that their mouths can't cash. They write checks that their mouths can't cash with certain companies, certain entities. And now we can't even get out of it contractually. If we have another cure, we're not even allowed to implement it. My friends, we got ourselves into a pickle. So just to be clear, guys, it works. The thing works. But now, of course, we have these new things, these variants. People who took this medicine, some of them are going in a hospital despite having the medicine in them. And now they're saying, well, we're going to blame the people that didn't take the medicine. Really? Seriously? Like, that's your, that's the conclusion that you've come to? I mean, I don't know. I really just don't know what else to say, guys. But just so you understand, for those of you guys who are watching, I'm not anti-anything. What I am pro is using this. I'll tell you guys one quick thing to end off. I have a friend with whom I was debating on this issue back in March, and he works in the biotech field and marketing, and he told me, I don't think there's anything to worry about. There's no indication that there's anything to worry about. That phrase set off a red flag, but then on top of that, he told me, this is a very intelligent guy, he told me, I spoke to my Rav, and my Rav told me, you're an intelligent guy, but sometimes let's not be too smart. Okay, so the guy went and took whatever he took. I don't know, he's okay. I don't know if he got the real thing, I don't know if he got a placebo, I don't know. And then 2 months later, without me prompting him, he goes on Twitter, he tags me on Twitter, and he says, so-and-so, you were right, to me. And I said, okay, I guess. Why the sudden 180? Okay, he went on YouTube, he watched a video from a respected person whose podcast he's been watching for a very long time. He respects the person's opinion, and this guy started doing his own research, and he saw that there is some issues with this particular medicine. There's issues. Not for all people. For some people, there are potential issues. And now he understands that, we just went a little bit too crazy. We went a little bit too crazy. And now we are where we are. So, anyway, guys, just understand, so people don't get it twisted. Something that takes 3 to 5 years to approve, if it's going to be approved in January 2022, it would basically be something that took less than 2 years to approve. This will be an unprecedented thing. You could say we live in an unprecedented time, fine, but just understand, whatever it is today is a phase 2 trial at best. Oh, I'm sorry, phase 3. Phase 2 for sure. So question is, do you want to be or participate in a trial or not? If you want to, more power to you. I personally do not. I have my reasons. That's basically the story, guys. Alright. Thank you for listening. And if I don't speak to you guys again, just know that the people took appropriate action. Or not so appropriate. Alright, guys. Laila Tov.